Hi everyone. Now I am going to talk about antiseptics. First of all, let's know what does the word means. The word anti means against and the word sepsis means putrefaction or becoming rotten in Greek. So antiseptic means against putrefaction. Commonly, antiseptics are antimicrobial substances that are applied to living tissue to reduce the possibility of infection, sepsis, or putrefaction. Now let's discuss about the first use of antiseptics. Joseph Lister was a British surgeon who pioneered the use of antiseptic in surgery. He was aware that the number of deaths after surgery was not caused by the operation but by the infection after the procedure. So he looked for a solution to find a way to kill the germs before they got a chance to enter the wound. Phenol was called as carbolic acid at that time. Lister soaked surgical dressings in phenol or carbolic acid and even applied it to surgical wounds, and his patients actually started to survive after his surgery. By introducing the idea of using an antiseptic to prevent infection, Joseph Lister's contribution paved the way to safer medical procedures, and no wonder he is often called as the father of modern surgery. But phenol is no more used as an antiseptic because it irritates the living tissues and it has a very bad smell. Now, let's know about the difference between antiseptic and disinfectant. Antiseptics are mild germ killing chemicals, whereas disinfectants are strong germ killing substances. Antiseptics do not cause harm to skin and body, whereas disinfectant may cause harm to skin and body. Antiseptics are used on living tissues, whereas disinfectants are used on non living items. Now, let's know more about the most commonly used antiseptics. And the first is iodine. Iodine is an oldest and widely used effective antiseptic. It is used both as an antiseptic and disinfectant. One of the most widely used formulations is povidone iodine. Povidone iodine is also known as iodopovidone. It is an antiseptic used for skin disinfection before and after surgery. It may also be used for minor wounds. It may be applied to the skin as a liquid or a powder. Trade names are betadine, pyodine, and vocadine. Talk to a doctor before using this medicine if you are allergic to povidone iodine or any of the ingredients of this medicine, or if you have any thyroid problems. Stop using this medicine and consult your doctor immediately if you have any side effects such as itching, swelling, redness, or irritation at the site of application. And the next is hydrogen peroxide. It is commonly used antiseptic in household for scrapes and cuts. Some people like to clean an open wound that doesn't require stitches. People think that hydrogen peroxide must be good because of that really cool bubbling action that happens when you pour it on your wound. But in fact, what's bubbling are your cells that are being oxidized and killed by hydrogen peroxide. So, if you are cleaning a reasonable wound, hydrogen peroxide can be a harsh treatment, and most experts agree that soap and water is a better option. Next is benzalkonium chloride. It is an antiseptic used to clean skin and mucous membranes. It is used as an skin antiseptic and wound wash spray, and it is used in hand sanitizers and in antiseptic creams. And the next is chloroxylenol. It is used as both an antiseptic and a disinfectant. It is used for skin disinfection and along with alcohol is used for cleaning surgical instruments. It is used in a number of household disinfectant and wound cleaners, and it is an active ingredient in Dettol. Friends, always dilute concentrated antiseptic before use as directed. Example, Dettol. And use all dilution within 8 hours and discard the remaining. Thank you, friends. Stay aware.